I'm Bruce Snyder. I'm a neurologist. I was telling Terry that I retired Monday after 43 years in practice. So now I can, thank you. So now I can do what I'm currently really interested in, although I was very interested in neurology. And the talk I'm going to give tonight is one that I actually designed for medical audiences. So I'll try to, break through the jargon. My purpose in talking to both medical and non-medical audiences is to try and raise the profile of climate change. And I really purposefully use those words, even though I know we sometimes get some blowback. To raise the profile of this issue to somewhere near the importance that it actually has. And coming from a medical background, my frame for climate change is as a major public health challenge, a major threat to our public health, a very expensive threat to our public health. So we're going to go through some of that, and then we'll see where we are. All right. Well, when I talk about climate change, I actually drop back a bit and say, the real problem is the combustion of fossil fuels. And if you drop back to that spot, then you take off and you say, well, okay, yes, there is global warming and carbon dioxide emissions, but also fossil fuels are a major, if not the primary source of air pollution and water pollution. And a lot of the health issues that come up really spin back to those. And when we're talking about air pollution, we're talking about ozone generation, sulfur and nitrous oxides, and particulates. And particulates, for the purposes of, for many purposes, are classified by particle diameter. The microparticulates are especially relevant to human health issues. Water pollution, flooding, extreme weather events wash surface pollutants into our surface and ground waters. Coal-burning power plants are the primary source of mercury emissions into our waters. And there we get all of the warnings about how often one can consume fish. I've often wondered how you actually do that. And then there's ocean acidification. Of course, the oceans act as these huge carbon sinks, absorbing much of the CO2 that we're releasing and coming into equilibrium with the atmosphere. And on a plus side, of course, as I'm sure you know, this allows the oceans to buffer some of the consequences of our carbon emissions in terms of weather, but in the process, the oceans become more acidic. And this is a problem in terms of sea life forming calcium carbonate shells. The shellfish industry has actually been lobbying Congress about climate change. And ocean acidification, ocean warming is another issue because ocean warming is driving fish populations out of traditional fishing zones. And it is the change in water temperature that seems to be bleaching the coral reefs. So a lot of issues there. From a health standpoint, and I'm, with this audience, with you folks, you understand what climate change and global warming is, so I'm not going to go into that. This is a statement by Margaret Chen, who's the Director General of the World Health Organization. And she stated that continuing climate change will affect in profoundly adverse ways some of the social and environmental determinants of health. Food, air, and water, fairly basic. Very importantly, areas with weak health infrastructure. Some of the poorer societies and nations around the world, developing countries, if you will be the least able to cope with the consequences of climate change. And this is where we get into issues of climate justice and where we, as a wealthy and a major consuming society, where is our responsibility and where is our moral and ethical response to what our emissions have been doing around the world. I tend to break down the health impacts of climate change in these categories, and certainly not original to me. The National Climate Assessment uses basically the same categories. So we're going to talk about heart and lung disease, stroke, and cognitive decline. And just to break that down, cognitive decline, I'm talking about the loss of mental faculties, the development of dementia, Alzheimer's disease, things like that. We're going to talk about developmental disorders, food and water insecurity and population displacement, infectious disease, heat-related illnesses and allergic disorders, mental health disorders, and the collapse of infrastructure and social support systems. We're going to do that all in 10 minutes now. See, if I point the laser at you, I apologize. I just remembered what you told me. Heart and lung disease and stroke. There have been a number of studies trying to relate sickness and death to various pollutants. And these are very difficult studies to carry out. And there aren't many studies done. We need more data. I mean, some of the problems, as you can imagine, are collecting data on large populations of people. That data may come from hospital discharge summaries or Medicare diagnostic group quote coding. There's a problem with accuracy there. There's also the problem of relating a population or a group of individuals to a certain level and type of pollution exposure, because we are a mobile society, and that's the difficulty. So with those caveats, let's talk about this. The American Cancer Society did a study in 2000, and this was published in Circulation by the American Heart Association in 2004. And what they showed was that they studied 500,000 people, and they showed that for each 10 microgram per cubic meter increase in levels of microparticulates, you can follow that, there was an increase in all-cause heart and lung cancer mortality. So what I'm talking about there is that if you're, and by the way, the EPA measures 12 microgram per cubic meter is the level at below which particulates are felt to be safe. So as we get above that, as we add 10 micrograms to that and another 10 micrograms to that, every time we go up by 10 microgram per cubic meter, all causes of mortality rise by 4%. Everyone dying of heart and lung disease, well, that number goes up by 6% for each increment of 10. Lung cancer mortality goes up about 8%, again, for each increment. There are cities with particulate levels of 300 to 500 microgram per cubic meter. Many of those are in Asia.
Or is it other countries?
I'm sorry, I didn't hear.
Other countries, or is it
China, Asian, India, But in the U.S., I mean, we have significant pollution in our major cities as well. It's been estimated that there are about 470,000 premature heart and lung deaths, well, respiratory deaths, so chronic asthma, emphysema, chronic obstructive pulmonary disease, COPD, things that you've probably heard of. 470,000 annually around the world due to ozone. Another 2 million from small particulates. But this PM 2.5, that's particulate matter with a diameter of 2.5 microns. And related cardiopulmonary diseases and lung cancer. So 2 million deaths from this type of pollutant, most of which are heart and lung disease and some of which are lung cancer. How do these pollutants do this? Air pollution again, the sulfur and nitrous oxides, as well as the particulate matter, promote vasoconstriction. Our blood vessels constrict. We are more likely to have arrhythmias of the heart, dangerous fluctuations in heart rate and rhythm. Blood pressure goes up. And these types of chemicals induce an inflammatory response in the body, which raises our white blood cell count, makes our blood more clottable, things like that. Going on, whoops, let me make sure okay. Going to stroke. The data for stroke is also interesting. There have been studies showing correlations, pretty solid correlations, between the level of air pollutants and the frequency of hospitalizations for stroke. There was a study from Sweden. French study in 2013 studied the effect of ozone levels on ischemic on stroke occurrence in older people. Every increase of 10 microgram per cubic meter, every increase of ozone by 10 microgram per cubic meter raised the rate of recurrent stroke by 12%. So if you already had a stroke in the past and you were exposed to this level of pollution, your risk of having another stroke rose by 12% for every 10 microgram per cubic meter increment of ozone. And again, so well, let's talk about pollution and cognitive impairment. Now, cognitive impairment, again, is kind of our technobabble for memory loss, difficulty with concentration, difficulty with decision making, and ultimately the risk of developing Alzheimer's disease. And one of the interesting pieces here, as you may know, is that with the aging of the population, we're looking at a very large number of people entering this illness called Alzheimer's disease. It's going to be, it is, and it will be extremely expensive for our societies to provide care for these individuals. And if we could find some correctable measure to reduce the number of people advancing to dementia, that would be a tremendous savings for our society, as well as a savings in terms of the human cost. And it appears that air pollution is a factor which, at least potentially, we could control, and a factor which is driving the decline in mental abilities, especially in our older people, but also in our kids, and we'll talk about that. So the risk of cognitive decline, impaired cognitive function, is increased by long-term exposure to increased levels of particulates, ozone, and nitrous oxides. Children and young adults living in highly polluted urban environments have increased levels of certain metals, manganese, chromium, and nickel, in the frontal cortex of the brain, with associated inflammation changes in the cortex of the brain and the olfactory bulbs. Now, the olfactory bulbs are two thick strands of nerves that extend just above our eyes, underneath the frontal lobes, and to the top of our nose. And that's where little sensory fibers come into our nose and register smell. And an interesting thing about this structure is that it is not sealed off completely from the external environment. Most of our brain is protected very, very well biologically from external pollutants and agents of disease. But through the olfactory bulbs, chemicals, microbes, viruses, amoebas can get in. And from there, there's a transport mechanism bringing these pollutants backwards into the brain itself. And so this study was measuring these changes at autopsy in children and young adults living in a polluted environment. Now, let me just see here. So again, so what we're pointing to is that exposure to pollutants that are generated, again, by the combustion of fossil fuels actually cause changes in the brains of people who are living in these polluted environments. And the changes in those brains varies pretty directly with the level of pollution. And the consequence is a measurable decrease in mental abilities in people exposed to these environments. Let's talk a little about developmental disorders, autism spectrum disorder, and learning disabilities. Again, I'm sure you've all heard a good bit about this. It's in the news pretty commonly. But one of the things to kind of focus on is that there is a dramatic increase in the number of children being born with autism spectrum disorders and learning disabilities. And if you go back to the 90s, the number of kids born in the U.S. with these disorders was about 1 in 150. Now it's 1 in 68. I'm sorry, it was 1 in 150 in 2002. So in 12 years, it's gone to 1 in 68. And there's a lot of research going on as to why this is. You'll read in the paper, there's some stories recently that researchers are looking at certain genetic alterations. But I think it's clear that the genetic alterations we're talking about here are not mutations, because you cannot, in 12 years, change the frequency of a genetic disorder by this magnitude. So what's going on? At least partly, it appears that environmental pollutants are modifying the genetic expression, the expression of certain genes in our nervous systems. And this is happening in the womb. Some of these are well-known neurotoxins. Mercury is extremely toxic to the developing nervous system. The Japanese found this out to their sorrow in the 60s. There was an area called Minamata Bay where many factories were dumping heavy metal pollutants as well and other toxins without any controls. And what began to happen was that the children born in that region showed an accelerating severe rate of malformations, mental retardation, and the Japanese finally realized that and cleaned that up. However, this is still going on. So mercury is a well-known, well-documented neurotoxin. The primary source of mercury in our lakes and streams are coal-fired power plants. There have been studies of mothers exposed to higher levels of polycyclic aromatic hydrocarbons in polluted urban environments. These chemicals are the products of incomplete combustion of fossil fuels, especially diesel. And there were, what the researchers found were significant correlations between the levels of these toxins in the mother's blood and in the umbilical cord blood, at correlations with subsequently reduced IQ, mood disorders, and attention deficit disorders in the children. And in this study, which was my hat's off to these investigators. They followed these kids up for 9 years and collected really excellent data. And this is another aspect of this environmental justice issue. But these the mothers they studied were in lower income neighborhoods, often communities of color. And that's where many of our pollutants are released. These are families that live near factories, they live near power plants, they live near incinerators, and this is the result. And I have to think, as I go and kind of educate myself on these things, when I think about the achievement gaps that our educational system is constantly trying to deal with, could part of that achievement gap be related to the toxic effects of pollutants on some of these children who are differentially exposed to these levels of pollution. Okay, well, let's turn to infectious disease. And let me see here. Extreme storms, extreme precipitation events and flooding, as we talked about already, threaten fresh water supplies and sanitation systems. Storm runoff and floodwaters contaminate wells, overwhelm septic systems, drive rodents into our waters, wash sewage and pollutants into reservoirs and streams. We just saw this in the West Metro during the spring floods. As you recall, there was a release of raw sewage into certain parts of Lake Minnetonka when I think it was Mound. Their septic system was overwhelmed. Most U.S. outbreaks of waterborne disease, these are diseases like, there are different names that won't mean too much, but they're usually diarrheal illnesses. We are exposed to these bacteria from contaminated food and water. Over half of the outbreaks in the United States follow upon very heavy precipitation events. Almost 2/3 follow upon heavy precipitation events. And, projections of extreme precipitation events are that they will increase. In fact, the northeastern United States is anticipated to have about a 75% increase in extreme precipitation events. Certainly here in the upper Midwest, we're seeing about a 35% projected increase, and we're feeling some of that already. So this is real. This is from the Minnesota Department of Health. Part of what's going on as we have longer, warmer, wetter seasons is that insects, disease-causing insects, live longer, breed more generations, mature faster. We have more tick-borne illness. This is a chart showing the increase in the number of reported cases of Lyme disease. Lyme disease, of course, is a disease spread by the deer tick. So if we go from 96, when over the course of a year there were about 250 cases, and you can pretty much see this rise to now there's about 1,400 a year. And if we look at another tick-borne illness called anaplasmosis that follows pretty much the same pattern. It's one of the reasons for the decline in the moose population in Minnesota seems to be an increased burden of parasitic insects. So we're seeing this at a number of levels. This is one of the reasons I may not retire to Phoenix. This is a dust storm approaching Phoenix. This was a couple of years ago. And of course, as we get into more extreme drought situations and more intense wind events, we'll see more of this. Now, these types of events also increase the exposure of people to soil pathogens, bacteria, fungi that are in the soil and the ground. And this is the rate of hospitalizations for a fungal disease called coccidiomycosis. It's better known as valley fever. And as we get here, we're seeing a definite trend upward in the number of people going to the hospital for this illness. Reported valley fever cases, the red bars are California, the yellow is Arizona, which is really the epicenter of this disease. And it is reasonable to conclude that these increases in insect-borne illnesses and soil-borne illnesses are related to the changes in climate. Okay, we'll switch gears and go on to food and water insecurity, population displacement, and conflict. Malnutrition causes millions of deaths each year, and with increasing temperatures and more variable rainfalls and more extreme droughts, crop yields in many developing regions are impacted. The East African area, with Somalia, Kenya, Ethiopia, has been experiencing a severe, sustained drought for about the past 4 or 5 years. And one of the reasons that our Somali neighbors are desperate to send a lot of money home is that food costs more. The scarcity is expressed in the cost of food. You know, here in the United States, the American cattle herd is now down to a population approaching the 1950s. And American packing houses are closing for a lack of animals. That just happened in South St. Paul, close to where I live. But we're wealthy, and so we can import beef. We can import other foodstuffs pretty easily. But other nations and areas cannot do that. And I just want to, before I go on to water, one of the ways that this plays out in populations is that the malnutrition is so intense that it affects the development of children's developing nervous systems. And one of the really ironic things to me as I look at this is that if we as a population, and well, let's say it as a species, are going to deal successfully with climate change, we need our smarts. And ironically, this process is dumbing us down. Well, globally, water scarcity also already affects 4 out of every 10 people. Lack of water and poor water quality, as we've seen, increases the risk of diarrheal illnesses. That's the waterborne illnesses we talked about, which kill approximately 2.2 million people a year. If any of you read The New Yorker, it was maybe within the past month, they had a portfolio of pictures from Southern California showing what that drought looks like. And it looks awful. It looks really bad. So farms and ranches are killing off livestock. They're pulling up hundreds of acres of trees because there's no water for them. And this is what's going on, and this is related to climate change. I hadn't realized that there is such a thing as the Center for Climate and Security. It's funny what you come upon when you're researching these topics. But this was a meta-analysis of 60 previous peer-reviewed studies and 45 data sets. So to put that in plain English, what these researchers did was they combined results in many different studies and came up with a significant causal link between a warming climate and the likelihood of different scales of conflict, ranging from domestic violence to conflict within a country or between countries. This is something that's beginning to take on some reality as we look at what's going to happen as water resources, freshwater resources, diminish. We are, as you well know, melting our bank deposit of fresh water as we melt the polar ice, the glaciers, the snowpack off the mountains. These deposits of fresh water are all we have. These deposits of fresh water feed the rivers and streams that provide us with clean water. The Himalayan mountains are a major source of water for 5 countries: China, India, Pakistan, Nepal, and Bhutan. And already China is setting up dams to divert more of that water into China. That's going to be a real challenge for India, and it's a challenge that likely will not be met quietly. Here in one of the causes of the southwestern drought in the United States is, again, the loss of snowpack in the Sierra Mountains, which ordinarily feed some of these major rivers. So this is happening now and will get worse. Heat-related illness. I was just talking to, watch these buttons. I was just talking to someone at the Department of Health who actually studies changes in heat-related illness, and is going to have some updated data for me. But Let's look at this. This is the projected temperature change of the hottest days, depending upon our levels of greenhouse gas emissions. This is a bar graph showing the changes in temperature that are projected to occur by 2100. I think this was like 1950 or 60 here. So over the course of about, say, 40 or 50 years, if we manage to reduce our emissions quite a bit, the rise in temperature in the continental United States will be about, maybe 4 to 5 degrees Fahrenheit, possibly 6 in some areas. But if we continue with our current level of emissions, those temperature changes will approach 15 degrees above current average temperature readings. And that will make it very difficult for our population. There was a study looking at what time frame tropical nations would surpass their historical peak temperature range given current levels of emissions. And they're looking at about 2040, 2050. And that's not long. It's long enough for me because I'm 70 years old. So I'm really not worried about this at all. But for some of you, it's going to be fairly close. Heat waves, in the past decade, there have been a number of extreme heat waves. In 2003, there was a prolonged European heat wave that caused over 45,000 deaths in 5 countries. The summer of 2010, areas of Russia experienced their most extreme heat wave ever recorded in their records, going back to 1880. There were temperatures above 5 degrees centigrade over average, so centigrade is larger than Fahrenheit. Estimated 55,000 deaths, 25% drop in annual crop production, total economic loss of more than $15 billion. 2013 brought severe and record-breaking heat waves and drought around the world. And extreme heat events, again, if you look at the National Climate Assessment, it's a good source, are projected to increase as well. Looking at different states, we can see that this is already affecting people. If we look at heat-related illness, so that would be heat exhaustion, heat stroke, things of that sort. In the year 2000 in Minnesota, there were 330 emergency room visits or hospitalizations for heat-related illness. 10 years later, that number had more than doubled to 740. In Arkansas, the numbers went from 1753 to 2336, and in South Carolina, 960 to 2274. So these are fairly dramatic increases. You can't really blame this level of increase on population growth or aging. This is far more than that. Trauma. Well, extreme weather events do cause a lot of injuries. This is the aftermath of a picture of the aftermath of Hurricane Katrina. There were about 1,600 deaths attributed to that, and many more injuries. Interestingly, many of the deaths and injuries were experienced by healthcare institutions, patients and staff, nursing home patients and staff, hospital patients and staff, vulnerable population. Again, more on the aftermath of Katrina. And let's go on. I should mention Typhoon Haiyan, which was the strongest typhoon ever recorded in the Philippines, with sustained winds of up to 195 miles an hour. A 17-foot storm surge in Tacloban, which was the where the epicenter hit. And there were over 7,000 deaths and multiple of injuries in the Philippines alone from that storm. Asthma and allergic disorders. Well, as we, again, experience longer, warmer, wetter seasons, the duration of the pollen season increases. And so in Minnesota, the pollen season has gained about, let's see if I can find it here, 16 days added to the ragweed season between 95 and 2009. The National Climate Assessment has similar figures for the north central United States. Now, 16 days, okay, let's say 2 weeks, more pollen exposure. That actually results in a lot of illness and a lot of care, expensive care. Asthma rates in the United States have gone up almost 20% in the past 10 to 15 years. Some of that, not all of it, but some of that is related to pollen, ragweed seasons, and pollution. Mental health and stress-related disorders after extreme storms or during extreme storms, there is a great deal of anguish and stress. Individuals who had pre-existing, who already were suffering from depression, psychosis, and other disorders, bipolar, may not be able to get their medications as these storms close pharmacies and hospitals and clinics. Their physicians, their counselors, and so on, not available. There have been significant percentages of post-traumatic stress disorder measured months later in populations exposed to Hurricane Sandy and Hurricane Katrina. Suicide rates go up, particularly during extreme heat waves. All right, well, let's close up here with the collapse of social support systems and infrastructure. When an extreme storm event does hit, Hurricane Sandy again, or Hurricane Katrina, or Typhoon Haiyan, power goes out, sanitation goes out, transportation goes out, EMTs can't get anywhere, the police can't get anywhere, the fire department can't anywhere, subways are flooded, transportation's down, hospitals are closed. I'll tell you more about that. Clinics are closed, can't get to them, staff can't get to them. Medical records, not available. Pharmacies, not available. These storms present a huge challenge to our health infrastructure. You know, many of our, in fact, if you think about the average hospital and maybe the average building, and I think most of you know more about this than I do, but where are the backup systems? Sanitation, generators, all of that. The basement. It's in the basement. When these hospitals close down, these are patients waiting for evacuation. So these are folks that have had heart attacks, have had recent surgery, they're critically ill, they're in the hospital. Nowadays you don't get into a hospital easily. So these folks had to be evacuated to other facilities. This is an emergency shelter. I think this was in the Superdome after Hurricane Katrina. And this is a story that really moved me. This is from a hospital, a large hospital in the area that was hit by Hurricane Sandy. And what happened was, again, power, elevators are gone, there's no sanitation, the plumbing, everything's gone, no lighting. So the staff had to try and evacuate patients to another facility. Well, what they had to do was lift these patients manually, push them on gurneys, carry their equipment, their IVs, their oxygen, whatever, up or down flights of stairs, Well, they finally got out of the building through a hole in the wall. There was a hole in the wall that led out onto a parking ramp. They got the folks out there, and then they had to climb these flights of metal steps to a helipad. Now, some of our patients are fairly heavy. This was a miserable situation. We need, as planners, and I try to talk to healthcare managers about this and emergency planners, we need to adapt our emergency plans to the increasing likelihood of these extreme weather events. And that's going to involve some increased expense, planning, and so on. Methodist Hospital, just as a side note, and I know I got to finish up. Methodist Hospital's data center, which is quite sophisticated and very expensive, is located in the basement of the building on the creek side. And so when the creek, Minnehaha Creek, flooded, they almost lost their data center at that point. So I am going to finish, and I'm not going to go into this. But when I talk about this to people, I think what I try to do is to say, first of all, I believe that stating up front that what we're dealing with is, yes, climate change. I use the words. I know some people get upset. We're also dealing with other consequences of fossil fuel dependence. We have solutions to get us out of this if we would only use them. And we are going to pay very heavily in terms of our health and in terms of paying for our health care because of what's going on. So I'm going to stop there. Thank you.
Any questions?
Yeah.
It seems to me that, health aspects of climate change never get that, big in the scheme of things. And I guess if you agree with that, why do you think that is? I mean, it seems like, all these other things come to play, but you don't hear the health aspects and the consequences as much.
Well, I'm not sure. I mean, it's interesting. Part of it, I think, falls on the shoulders of the medical establishment. Your doctors and nurses, whether we deserve it or not, are viewed as part of the scientific leadership of our communities. We're in the newspapers, people quote us, they get stories. There are 20 physicians and 6 nurses in Congress, and the large majority are climate science deniers. Now, if physicians and nurses aren't ready to stand up and talk about this in a logical, informed way, it's hard to expect other people to do so. One of the things I'm working on, as I mentioned some, is developing a continuing medical education course on climate change for doctors and nurses and so on. But that's now the National Climate Assessment, which I'm sure you're all familiar with, has a very well-developed section on the health consequences of climate change. The Minnesota Department of Health website has extensive information. They've got a great website on it. It's done a lot of good work. So it's out there, and I guess that's one of the reasons I talk about it.
All right.
All right. Thanks for your attention.